Buenas tardes y gracias a Dr. Xavier y Dr. Neira y también a la Congreso por su invitación para presentarse nuestros días la data. So thank you all for coming and listening. The subject of this talk will be to go over open-label data following the Alleviate trial using Epratuzumab. Here are our disclosures, both of members of industry as well as investigators. So just to start with basic science a bit, CD22 is a B-cell surface molecule that is thought to be important in B-cell adhesion and signaling. It is a humanized antibody. The 22 molecule is expressed preferentially on mature B cells, especially on naive cells, less so in memory, and then substantially decreases when you get to the plasma cell stage. So we think that Epratuzumab modulates B cell function without extensive depletion. I'll show you that in a bit. And there have been several studies in vitro that have shown that it does affect this B-cell marker. So to begin with, the double-blinded placebo-controlled portion that preceded the open-label data was Alleviate 1 and Alleviate 2. So it's a double-blind placebo-controlled trial. Both of these trials were terminated prematurely because of interruption of drug manufacturing. So they went back and did a little post hoc evaluation, small n's, but felt that that would cause people to go ahead and proceed with the data. The 06, which we'll be talking about, was an open label extension study from the Alleviate trial data. There's 29 people that are to be presented today. Median of 210 weeks, or about 4 years, but some over 5 years of exposure of this drug. So the primary objective of the open label trial or observation primarily was look at safety and tolerability, but there were secondary assessments to look at efficacy with the BILAG, the SLEDAI, corticosteroid doses, and B-cell counts, as well as health-related quality of life using the SF-36, both physical and mental. So to begin with how the disposition came with all these small numbers, from placebo, from both groups, 8, from the combination of 1 and 2 at the 360 milligram dose, 17, and from Alleviate 1 at the 720 dose, there was 4 patients. There was a median delay due to this manufacturing issue of about 52 weeks. So you can imagine that it was quite difficult for all of us to keep patients in, the investigators. The open label trial was initiated in September of 2006, again, with this 29 people. 10 were from Alleviate 1, which was a more severe trial by LAG A, and 19 from Alleviate 2, or more moderate, by LAG B. They received doses 1 week apart, and every 12 weeks. They had assessments every 4 weeks, including the BILAG with the SLEDAI done every 24 weeks. Over the 4 years median, 13 discontinued, 4 from adverse events, and 1 from lack of efficacy. This study, 06, was closed in January 2012 with 16 remaining, and they were rolled into other, now continuing to proceed, open-label trials. So the median was around 40 years, most were female, most were Caucasian. Just to kind of look at a couple of things going from the Alleviate baseline to the 06 screening, or V1 there, you notice that nobody was on 0 to 7.5 milligrams of steroids per day, whereas at the V1 screening, 15 were, and in the greater than 20 milligram dose, 15 at the baseline of Alleviate, 1 at the 06 screening. Similarly, we saw decreases in BILAG and SLEDAI, and substantial numbers were on immunosuppressants and antimalarials along with this drug. So in a summary of what the adverse events, any adverse event the most common things that we see in most of our clinical trials, URIs, sinusitis, UTIs, etc. But in the serious adverse events, infections, and around 17.2%, and other musculoskeletal disorders, about 10.3% of note, there were no opportunistic infections described. In terms of leading to discontinuation, there were some other reactions kind of across the board. And there were 2 deaths, both considered by the investigator to be unrelated to study drug. So look in graphic form of the effect that going over this 4 to 5 years of an 06 open label trial. The graphic here in the dotted line goes from the beginning of Alleviate to the visit 1 of the 06. And you can see there was a substantial improvement in the BILAG, which was then maintained over time, more or less with a bit of a scattergram, as you would expect with this measure. Similarly, the median SLEDI from Alleviate to V1 decreased substantially and then was held over all of this time. We want to look at a graphic of the corticosteroid dosing. What we had already mentioned before was that you did see some people that would come up with 0 corticosteroids during 06. In fact, at week 204, 4 patients had completely discontinued steroids, and 10 patients were receiving not more than 7.5 milligrams per day. So the purple at the bottom shows the beginning of zeros and held out, whereas the yellow is in the 0 to 7.5 that begins at V1 and then sort of increases a bit, if you will. Orange at the 7.5 up to 20 milligrams. You can see it kind of bounces around and gets smaller, and then the bad guy color, the turquoise, of the 20 milligrams or more, quite a bit at the baseline, and it kind of dips away towards the end. So in the counts of the B cells, there was a reduction in long-term treatment. It stabilized at about 55 to 65%. Lower than the baseline, which was about what we saw at the beginning from Alleviate to V1, and then it maintained that. Of note in Dr. Petrie's poster that she presented yesterday, there were no real changes of significance of the immunoglobulin levels, IgA and IgM, around 8 to 15% maintained, and the IgM decreased to about 30%, again maintained over time. So this, and looking at the health-related quality of life, or the SF-36, the scores in the green are the minimal clinical important difference between Alleviate and baseline, orange, both of V1s, and what you can see is really across the board in the physical findings that they all showed some improvement and maintained. The mental area, as we would expect, didn't really show much change. A few things, vitality, social function, a little bit better. So in conclusion, I feel that Epratuzumab was really very well tolerated. No safety signals over this 4 to 5 year time of exposure, although to a small n. So we do see also that continued administration also reduced corticosteroid dosing. Peripheral B cell counts went down but stabilized, didn't really affect immunoglobulin levels. And then from a health-related quality of life, patients also reported improvements in that, mostly on the physical things. So all of these data, plus the data from the 06, have prompted a phase 3 trial, which is currently enrolling. So thank you very much for your attention.
Thank you, Dr. Hobbs. We have time for some questions. There is here, left.
Yes, sir.
Hi, thank you very much for a nice presentation. I wonder, you used the classic BILAG. I wonder what scoring system you used. Traditionally, we used to use A9, B3, C1. Subsequently, we did a lot of work in the BILAG group and showed that the optimal way to work out the classic BILAG is A12, B5, C1. And I just wondered which one you'd used in those studies.
I'm not quite sure that they have changed a bit through the time frames in terms of which bilags between the the interruption went to immunomedics to UCB, so there was a bit of a change there.
There is no more question. Thank you very much again.
Thank you.